We can now welcome viewers on our digital platforms where we're continuing the programme for an extended coronavirus Q&A with our specialists Emily Morgan and Tom Clarke, who are here with me now. Just head to itvnews.com to ask your questions. And Tom Bradby will be here with news at 10 from the ITV Evening News team. Goodbye for now. Hello and welcome to this live Q&A on the coronavirus special programme. This, of course, we're going to be answering your questions with the help of ITV News health correspondent Emily Morgan and science editor Tom Clarke. Now, you can ask your questions by emailing your story at itn.co.uk, or if you're watching on Facebook, by posting in the comments section. But before we start the Q&A, let's bring you up to date with the latest developments on the outbreak as we have them. So the number of coronavirus cases in the UK stands at 373. That's up from 319 yesterday. 6 people have now died in the UK. The latest patient was in his 80s, we're told, and had underlying health conditions. In Italy, 168 people have died in a single day from the virus, as we reported in the programme, the biggest one-day increase recorded so far. Italy's death toll is now 631, the largest outside China, where the outbreak began. OK, so let's get some of your questions. Emily, Tom, before we start, we have had a lot of questions from people about their own health conditions, what they should do. What general advice would you be giving people? Emily, you start.
I think first and foremost is always to follow the advice of the government. So go on Public Health England website and find out what the advice is. I think it's very, very difficult to actually talk about individual cases. Of course, we're not doctors. I think individuals should speak to their consultants. They should call 111 if they really are concerned and take the advice of the experts on the end of the phone.
What are your thoughts on that, Tom?
I'd agree with Emily. Everybody's different. Just because you have a pre-existing medical condition does not necessarily mean you are more vulnerable to coronavirus. Statistically, those are the people who are more vulnerable, but it really depends on so many other factors to do with your age, your general level of fitness, what that pre-existing condition is. We're learning about that virus all the time. I think the best people to speak to really would be the specialist that's looking after your particular condition, or your GP in the first instance. If you can't get through to them, 111 is an option. Or obviously, if you're having any symptoms, a high temperature, a cough, shortness of breath, those of coronavirus, again, call 111 and just as a precaution, stay home. Try and limit your contact with family members.
OK, so I mean, that's the key point, isn't it? Because one of our questions, Kerry Simpson, says, you know, what do you do if you think you've got it? Do you stay at home or do you go to hospital? And you stay at home,
yeah,
right?
That is the advice. Stay at home and talk to 111. I think what the government don't want is people to be getting into taxis, going to A&E if they've got any sort of symptoms, if they have travelled abroad to any of the countries that have got outbreaks of coronavirus. The advice is just to stay at home and call 111. It's as simple as that. One of the best ways of spreading this is to walk around, go to A&E and, spread it.
Or go down to your GPs.
Yeah.
And I think that I was speaking to an A&E doctor the other day, and what they're saying is actually before you're even allowed through the door, practically through the door, someone is going to ask you, how are you feeling? Where have you been? And if they have any reason to suspect you might have coronavirus, they're not going to let you anywhere near a doctor or another patient anyway. So it really is best to stay at home and make that call.
Yeah. Hospitals have set up these special pods outside A&E. So they're sort of like 111 pods is what they're calling them. Anyone with symptoms who's travelled abroad or who has coronavirus symptoms will be taken into these pods. They're kind of like porta cabins, if you like. And there will be an advisor in there, either a 111 advisor, or they can use a telephone, or they can go online and talk to 111 that way. So just as Tom said, you're not going to be able to just go into A&E and walk around if you've got symptoms. You will be sort of almost isolated, if you like, before you even get...
Well, you and I were in the 111 centre in Dudley, weren't we, last week? And nationwide, I think they're increasing the number of 111 operators. Is that right?
Yes, they absolutely are. That was announced last week. They're also encouraging people to go online rather than call, because they're absolutely inundated with calls at the moment. The people we were speaking to, their calls are backed up on the telephone. You know, they just don't stop. So the advice is to go online, to do it online. You'll be asked loads of questions. You have to answer those questions, and then the advice at the end of that, you know, of what to do.
Just picking up on what you were saying about not obviously feeling qualified because you're not doctors to comment on people's individual cases, but it's interesting. Some of the questions that we're getting, as a lady, Sylvia, says you have 42% lung capacity due to COPD. What are my chances of survival? And I know you don't want to comment on specific cases like that, but these are the sort of concerns that are out there for people, aren't they? People are really frightened.
They are frightened, and I think it's because a lot of what we're saying is, you know, a lot of the deaths are in people who are either elderly, vulnerable, and have underlying conditions. So anybody who does have an underlying condition is obviously going to be extremely concerned. I think the only real concern is when or if you start to show symptoms. I think that, you know, day-to-day life at the moment, Tom, you may disagree, but I think to do nothing unless you've got symptoms and not to worry. I think one of the best way to contextualise this and to put it into perspective is to think about the flu. Now, in a bad year, a really bad year, 10,000 people could die of the flu. At the moment in the UK, we are talking about 6 deaths from coronavirus. Now, of course, yes, we don't have any immunity to this, and we do have some immunity to the flu, so it's very different. But I do think people need to keep putting this into perspective.
And broadly speaking, the same people who are at risk for things like the flu are the same people with coronavirus. I just chip in here. I've just had a tweet from somebody asking, and this is another question we're getting quite a lot of, are pregnant women in the high-risk group?
Yes.
Because I know with swine flu, that was a particularly interesting strain of the flu that was the pregnant women were particularly vulnerable to. One of the good things about coronavirus, it seems, from all of the people infected in China, many of them were pregnant women. It doesn't seem to have any really negative effects on pregnancy at all. And someone went on to give birth actually while they were infected. It didn't seem to have any negative consequences for their child either. So we don't know everything about this virus, but there's no indication as yet that pregnant women have any reason to worry. And also children, as I think has been fairly well discussed, children don't seem to be vulnerable to illness with this either.
Okay, which is a sort of peculiarity of it, isn't it?
Yeah.
You see, I think this is one of the questions that I get a lot, and I'm in no way qualified at all. But people say, if, you know, take into consideration what you said about the number of deaths we get from flu every year or in a bad year, why are we so worried about COVID-19 in that case? But we are. So explain.
Tom might be better to answer this, but just very briefly, we don't know anything about it. We know nothing about this. We have no immunity to it. So we could be on the tip of something very bad. We don't know yet. Yeah. We're not at that stage.
I think the anxiety is it's partly because the academics and the doctors and the scientists are applying a precautionary principle. If you don't know, it's best to be, you know, to treat it as if it's, you know, worse than it is, and then, you know, prepare for the worst, hope for the best type strategy. And I think the chief medical officer said exactly that. I think the reason they are taking it a bit more serious, there are some sort of stats behind this. Seasonal flu, on average, kills about 0.1 or 0.2% of people infected. A small minority. And again, they tend to be the most elderly or people with pre-existing conditions. From what we know, coronavirus is more like 1 or 2%. So it is, you know, at least 10 times, potentially 10 times more lethal. What we don't yet know is how is it going to behave in the UK setting. You know, our population is different from China's. It's different from Italy's in terms of its age, sort of demographics and things. The way we treat people with critical illness, we're also putting in certain measures earlier than some other European countries. So do not, at this stage, panic. We don't quite know where we are, what we're dealing with, and for the vast majority of people, even the majority of elderly people, even people in their 80s, far more people are going to survive this than succumb.
Okay. Thank you. Liam asks, and you were talking about the provision the country's saying, the country's making. Liam says, what are the plans for the country in the case of a nationwide COVID-19 outbreak? So what are the plans? What will happen? What will we notice immediately?
Well, at the moment, we're in the containment stage. So what we're noticing at the moment is the government advice is to wash your hands a lot, stay at home if you've, you know, travelled to one of these countries and you've got symptoms. So that at the moment is what we're noticing. if the government decides to move to their next phase, which is delay, then that's when we will start to notice more kind of social distancing. So it'll be things like limiting gatherings, perhaps looking at major sporting events, whether to postpone them or cancel them, closing schools. Those are the sort of practical things on the ground that will happen that we will start noticing. Now, if this does turn into an outbreak, the government will then probably move quite quickly, if you agree, into the mitigation phase, which is when you are sort of literally trying to deal with the fallout and the impact that this outbreak will have on the NHS. And that might be, bring back retired doctors, bring back retired nurses, free up capacity at hospitals. Maybe I know that the government are talking to private providers to try and increase capacity to bring staff in from private healthcare. The government has talked about telling the police force to only focus on serious crime, bringing the army in to help. I mean, those are much more drastic measures, aren't they, where we will start sort of seeing a social impact and a financial.
I think Emily's described them all very well, and I think one of the things that people are sitting there, seeing what's happening in Italy, they know we're probably heading in a submersion. Why aren't we doing more now?
Well, exactly, and that's the question I was going to ask you next from Gina. Why not now? Why not do it now?
Absolutely, why not? I think because some of the things that Emily was describing, and they're on a sliding scale, and many of them we hopefully will never ever get to, but they are going to cause some disruption. They're going to cause some hurt. They're going to inconvenience people, potentially make people's lives and jobs more difficult. What the government doesn't want to do is bring them in too soon, for two reasons. One, they cause unnecessary suffering. Two, you also need to make sure people adhere to them. And what we've seen from Italy, if you bring them in too early, people start to break the rules, bend the rules, get around the rules somehow.
Because they don't take it seriously at that stage.
Exactly.
Well, they've got bored with it, and it's difficult to continue. Isn't it?
And then they have to be sustainable things. And I think that the scientists advising government tried to make that as clear as they could yesterday. But in the backdrop of anxiety, I can see why people are beginning to ask, shouldn't we be doing more sooner? I think what we've just got to put a little bit of faith in government here, and it is our job as journalists to ensure that government are making the right decisions. And believe me, we're trying our best to stay across their methodology and their reasoning. But let's give them the benefit of the doubt for the time being. They are trying to hold off because some of these things will cause disruption. And the later we put them off as possible, it could overall benefit us in the long run.
OK, because again, to return to this question from Gina, she says the government says it wants to delay the outbreak until the warmer months, or at least until the pressure from winter illnesses are off the NHS hospital. But I think the virus has other ideas, says Gina. It's not going to wait until the UK government decides it's ready to cope. Is this delay simply because the government is waiting until it's ready to cope, do you think? Or, we should have faith, in other words.
It's true they have to get their act together.
Yes.
It does take a long time to speak. The NHS is a very big organisation. Other people, businesses, supply chain bosses, they all need to be brought into various briefing rooms and talked to. Yes, that does take time, and there surely is an element of that. However, the warmer month stuff does make sense. Viruses don't get spread as much in warmer months. People are outdoors more, they're in less confined spaces, and also there is that less pressure on the NHS. So it would be better, if we're going to have a peak in an epidemic, it would be better to have it in the spring and the summer, with time for the NHS to recover before winter. And so you don't want to, the other thing is you don't want to get too hard on it. You don't want to suppress the outbreak too much, a la Wuhan province in China, lest you push it all the way into the winter. Because what you don't want to do is have low levels of spread through the summer and then have another outbreak in the wintertime. So that's the other thing. Actually, we quite want to see, in a contained and controlled way, a little bit of an outbreak this spring and summer, because that's, in the absence of a vaccine or any drugs, that's the best way to spare the NHS with our own immunity.
Will it ever be possible to get rid of it entirely now it exists? Is it something that's going to be back year after year?
Do you want me to? I can have a go at that.
I guess no one knows.
If we develop a really good vaccine, which is going to take at least a year from now, probably a bit longer in all honesty, but if it's a good vaccine, you'll be able to vaccinate it away. I mean, like we can vaccinate some viruses down to very, very low levels. Indeed, look at measles is pretty much eradicated, unfortunately, because of some bad journalism 20 years ago, is sort of coming back and forth. But vaccination could kick in a touch. Some of these viruses disappear of their own accord. We build up natural immunity, they run their way around the globe, like swine flu did in 2009, hasn't been seen since. So SARS has not been seen since it emerged. Now, this is obviously a different virus, it's gone pandemic. Other viruses mutate a little bit. Flu is constantly changing its face, so keeps coming back. too early to say, but yeah, some viruses you have to learn to live with, others go away. We don't quite know which way this one's going to go yet.
I'm going to... Oh, sorry, Emily, yeah.
No, I just... sort of another question
Please.
to you, but COVID-19 exists now. You know, unless it just disappears, it exists, and we'll have to live with it and deal
We
with
have
it.
to get...
We need a vaccine.
Yeah, okay. A question from Perry Marshall. And this is an interesting one, I think, again, because, again, it's a question I've heard a lot. Why aren't airports screening passengers when they arrive? Perry says, we flew into Heathrow from Singapore yesterday. There was nothing. At Changi Airport and throughout Singapore, we were screened regularly, and there was hand sanitizer almost everywhere. Why are we not doing the same?
Well, on the hand sanitizer, I mean, personally, I've noticed an awful lot of hand sanitizers everywhere. On the
If you can get it.
Yes, if you can buy it. On the airport screening, I think the reason they're not doing it is because it doesn't necessarily work. I mean, you could take every passenger's temperature as they come into the UK, but of course you could be carrying the virus without having a temperature. There's an incubation period of up to 14 days, so you could be carrying it, you could develop symptoms 24 hours after you come back into the UK. So I think the general feeling is that to screen passengers is to give them almost a false sense of... What I'm looking for, security. Yes, exactly that if they're, you know, it might look good, it might make them feel safe, but actually it doesn't necessarily work. There might still be hundreds of thousands of people coming through with...
There's a suggestion a lot of countries maybe brought it, it makes people feel that their government's doing something. And again, we've just been talking about that. I want to see the government doing things. Everyone wants to see us doing stuff. The US did airport screening. It looks like the people who started the outbreak in Washington State, which has actually led to the US's first deaths, they flew through US airports. They didn't have a temperature at the time. And the US have now stopped doing it. They realised it didn't actually work. Another question I got on Twitter today, you probably, I'm sorry to jumping in, you probably got it on your pile there, was why didn't we close our flights to Italy? You know, this is a country with a raging outbreak, surely keep people out.
Which finally happened today.
But it didn't make any difference for Italy. They were the first country to shut their airports to people from China. But they clearly did it far too late, because by the time they'd done it, it was already there. And in truth, we've already got community transmission here in the UK. It's too late to keep coronavirus out of Britain. It is here. Obviously, reducing the numbers coming in would, of course, help, but it's not.
Can I just stop you? What does community transmission actually mean?
Forgive me. So what that means is, you know, even I'm slipping into jargon.
I know, there's lots of jargon. We hear it, we nod, but actually what does it mean?
It just means a case of the infection isn't linked to a known other case.
Okay.
So at the beginning of the outbreak, people only got it if they had direct contact with China, they'd flown from China, or they'd been unlucky enough to be infected by somebody who just arrived. What we're now seeing is the first few cases, there hasn't been a huge number, 10, I think maybe up to 15 now, of people in the UK who've popped up with an infection that's not linked to foreign travel, that's clearly been circulating in the UK. And those numbers will climb and climb and climb. Yes, transmitted in the UK. Yes. And those numbers are going to climb. So we now are in our own outbreak, and there's not really much we can make to do that go away, which is why Emily was discussing that delay phase. Now it's about just slowing that transmission down.
Okay, you were going to
well, I was at a briefing with Professor Whitty, the Chief Medical Officer, a couple of weeks ago. And he talked about this very thing, the travel ban. He said, you know, there are things that we know work, and that is things like washing hands and sneezing into tissue. It sounds silly, but it works. And he says there are things that we know don't work. And yes, a lot of people are saying, just, you know, ban flights, ban people from going, ban people from coming. He said it simply doesn't work. It might delay an outbreak, but only by, and he put a very specific figure on, 15 days.
15 days?
15 days, very specific. So there's no point in doing that. So it looks like a good thing to be doing, a bit like screening at airports. It looks like the government are doing something, but they need to focus on the things they know works. And I think, as Tom was saying, we need to trust the government and the scientists on this.
Okay. Andy asks, what would lockdown in the UK actually look like?
I suppose in many ways, like Italy.
I'm shrugging my shoulders. I don't quite know, but yeah,
no,
I imagine
it
would be like
getting people to stay at home, so children won't be going to schools. I think people will be encouraged to work from home, not go to work. Banning travel on trains.
Or would they do it? You know, regionally, would you have, you know, if you have a particular intense outbreak in a particular area, like Italy tried this, would you try and put a wall out? From what we're getting, it's not something the planners are willing to certainly discuss, even off the record, with journalists at the moment.
That's interesting.
Possibly because they're the sorts of things you want to keep up your sleeve, because you don't want to tip people off, because a travel ban doesn't work if people can travel around it.
Yes.
But also because it's sort of a last resort thing. You don't really want to be getting into that kind of territory if you can avoid it. But I think they've made it clear it is always an option they are keeping under review, and we might find ourselves in that situation.
Okay, and to pick up on the school thing, Lindsay says, if parents wish to take their kids out of school due to underlying health issues now, in other words, before the government has said that they should, would they be prosecuted or fined for doing so?
I don't know. I think it's unlikely, and that obviously that comes down to the individual school. At the moment, the government advice is to continue sending your children to school and not to close schools. If your child has underlying health issues and there has been an outbreak of coronavirus at the school, or sort of a case of coronavirus at the school, apologies, then I think, yes, perhaps seriously think about keeping your child at home. But then again, maybe ring 111, look at the government advice. At the moment, the advice is not to close schools. Schools have been taking their own decisions about whether to close and do a deep clean. And I think it's really dependent on the individual school.
And a sort of related question in another way, at the other end of the scale, should we be taking our residents out of care homes, if possible, elderly residents, bringing them home?
I think
I'd
that's
say
a real
no.
worry, isn't it?
I'd say no. I mean, one of the things, obviously, what we don't want to have is coronavirus introduced into a care home environment. That is a group of vulnerable people who are, you don't want it spreading. But all the time, you've got to be thinking about, so it's the same with taking kids out of school. If they're going to be going around and visiting their grandparents and have the risk of carrying an infection with them, that's sort of mixing. That's one of the reasons the government are reluctant to close schools, because that could actually help spread it around. Because, I mean, personally, if I had to come to work and take my kids to school, I might have to get my mum to look after them. I don't want her being exposed. It's these sort of things about how you manage those things. Possibly, I think the next phase we're definitely going to see is trying to keep the virus away from the most vulnerable. So possibly, you might be safer leaving parents or the elderly, loved ones who are elderly, where they are, at least for the time being, until as long as you're confident about the sort of the security they're in. But the other thing we've got to worry about, if we're coming to self-isolation, we don't want to alienate people. I mean, people could become very lonely and very isolated as a result of isolation.
Particularly elderly people, actually, as we saw in that piece on
It's going to be a fine
news.
balance thing about how to keep the elderly and the vulnerable people safe without isolating them socially and psychologically, because that could have a much higher risk to their well-being, actually, than coronavirus in the full analysis. That's the other thing we're always balancing here, is what's worse for an individual, not necessarily the same as what's best for society. So what's best for an individual isn't necessarily what's best for society.
No, I see what you're saying. So it's kind of a series of compromises, isn't it? When life and death ones.
So we're not very helpful here. We're trying to lay out how complicated some of these decisions are.
Yeah, they are complicated. We've got another question about school, actually. Sophia says, what will happen with GCSEs and college exams?
I don't know. I suppose if the government goes down the route and we do have an outbreak and the UK does go into lockdown and children do have to stay at home, exam papers, I imagine, will be sent home, or they'll be doing the exams online, or they'll be postponed.
Okay.
That's sort of...
Will retired health workers be forced back to work? Forced back to work is the question.
Sorry,
will retired health workers be forced back to work, asks Jenna.
No, I don't think they'll be forced. My understanding is that they have, that legislation has been put in place to allow them to go back to work. No, I don't think anyone's going to be forced. They're being asked to, and those who want to will.
Okay, all right.
And that's not easy either. I mean, as I understand it, Emily, I think you've done one to be, but they have to be retrained and relicensed. If you've retired, you actually have to be relicensed as a doctor to practice.
And you have to pay to relicense.
You can't just sort of wander back into the GP's practice and start doing so. It's a not a simple step, but they are working on that. But I don't think anyone's going to be sort of conscripted into coronavirus care, except possibly the military, of course, who are on standby if needed. But we're not, again, thankfully, anywhere near that yet. I just got another tweet here saying we're scaremongering here, which I mean, I don't know.
Do you think you are? I don't think we are. I'm really hoping that we're not. We're trying to inform, right, and answer questions, and be measured about it.
And I think I just tried to lay out why we're not, because again, some people say, if this was seasonal flu, if you reported every seasonal flu death like you're doing coronavirus, we'd be panicking national time.
And that is a fair point,
I tried
isn't it?
to elaborate there why we're just dealing with this with a little bit more, quite a lot more caution, because it's, like we said, it's unknown, and it is, on paper, 10 times more deadly than flu. When we know what impact that can have.
And yes, a lot of what we're talking about is hypothetical because we don't know. But I suppose this is what the government and the scientists are doing. They are looking at the countries who are also having to deal with it. So we are looking to Italy to learn lessons. We're obviously looking to China to learn lessons. So I think what Tom and I are trying to do is relay what we're being told from the government and the scientists and try and allay people's fears and not stoke people's fears.
OK. A final question, because we've got so many, we've got hundreds coming in, we can't do them all. Can you catch coronavirus more than once, says Carl?
Ooh, this is a good one. I actually had to call...
This is a big question,
I saw this
isn't it?
coming up. I had to make a couple of calls on this. There are a few cases of people who have been tested positive for coronavirus, become ill, been discharged from hospital feeling well and tested negative for the virus, who've then come back in feeling ill again with the virus. It led to some anxiety that there was this possibility you could be reinfected. There are some viruses, hepatitis C is an example, which you can be reinfected by once you've got rid of it, but they are rare. And it is most likely, what we're seeing, so we know the tests aren't perfect, people are testing negative because the virus has got to a low level in their body but hasn't gone away. For some reason, their immune system is having a bad day or a few days off or something, and it comes back. It would break a lot of rules of how we understand the immune system works, that it could fight off a virus and then forget how to do it again so that you could be reinfected with a virus down the line. Also, on the big outbreak scale, if that was how coronavirus was behaving commonly, China's outbreak wouldn't have gone away as it's now sort of going into effect. It would be carrying on. The honest answer to that is no, I don't think you can. OK. And a final question, and this from me, actually. Is there a chance that this might all just go away?
Yes. I mean, you might...
Is there a chance? Or is it inevitable that we're going to have, you know... with the proper outbreak?
Emily, go ahead.
No.
OK, I'd say, given that we're seeing mortality already linked to coronavirus in the UK, it's not going to go away. Those deaths signify we have got the virus spreading out there in the community, not at a particularly high level. You know, we are not seeing lots and lots of illness. So it's not going to go away. It is there. It is out there in the UK. But what we don't know, we really need to find out, and a lot of people working hard to do this, how much is there? And for most people, how is it even... It might be not causing very much illness at all in a lot of people, and it will cause very little disruption. People may be turning around in a few months' time telling us that we overhyped it and we got it all wrong and we terrified of nothing. Personally, I would rather that than missing what could be a real negative impact on society. So I'm willing to take that risk right now. But I don't think it's going to go away. But I think it would be reasonable to hope perhaps it's not going to be as bad as some of those worst-case scenarios our planners and our governments have to sort of go by when they're making... Well, you have to plan for worst-case scenarios, otherwise you're not doing your job.
And if they didn't, there'd be criticism.
OK. But the overall message, broadly, keep calm and carry on, would you say?
Yes, to take a government advice. I mean, yes, keep washing your hands. Take advice.
Keep calm, wash your hands.
Wash your hands.
And carry.
And also we get into a phase now, I think, where it's going to become... it is going to spread a bit more widely and more people are going to get it. If you feel ill, and I think the government are going to change their advice, they hinted at this earlier this week, yesterday. If you have symptoms of a cough and a temperature, stay at home. You know, if you feel really bad, you should do that anyway for basic flu control. But as we get more cases, it's going to become more likely that it's coronavirus and not. So far, it's most people right now have probably got colds or flu. But as we start to get some more cases, just stay at home, because you're doing yourself a favour by looking after yourself, and you're doing society at large a favour by making it less likely that you're going to pass it on.
And I think, remember that the majority of symptoms are mild or extremely mild. And I think that a lot of the talk over the last few weeks focuses on the severely ill, people that have died. But I think it's very important to remember that if there's a mortality rate of 1%, 99% of people are absolutely fine and the symptoms are generally mild.
OK, I think we'll leave it there on that non-dramatic note.
Yes,
and I think I feel a little bit reassured from that. Thank you very much indeed, Emily and Tom. And that's it for this live Q&A. But you can get the latest information and advice on the coronavirus at itv.com/news. But from all of us here, from me, Tom and Emily, bye-bye. Thanks for watching.